Gross. What are you going to find on gross examination? Well, I just told you. You're going to lose your brain. You lose your cortical atrophy. And when you do, what happens to sulci? It gets deeper and deeper and deeper. This is not a good thing. You have compensatory ventricular enlargement. In other words, what do we call this? Hydrocephalus ex vacuo, right? Compensatory ventricular enlargement. Why? Due to your cortical atrophy. You put these together, don't memorize them. It's the same thing. It's just a story. Microscopically, what are you going to find? Okay, now these are interesting. What I haven't talked to you about yet in great detail is neurofibrillary tangles. But what I have talked to you about and I've shown you is the beta amyloid plaques, correct? So what do the plaques look like? It looks like a plate. So a plate is large. What about neurofibrillary tangles? You know what sperm looks like? You know what sperm looks like? They look like little tadpoles, don't they? So whatever you want to use here in terms of description, yes, I'm being dramatic because I need you to know the difference. And these two are huge points pathologically on a microscopic level. So if you find sperm in the brain, well, do you understand how silly that is? Or tadpoles in the brain, that's your neurofibrillary tangle. What is it? It is hyperphosphorylated tau protein. Tau. Tau. Anyhow, I shouldn't have said patau, but tau protein is neurofibrillary tangles. These look like tadpoles or sperm in the brain. Now, let me tell you something. Each one of us, as we get older, we're all going to develop neurofibrillary tangles. You can't help it, okay? It's just kind of like as we get older, there's every possibility of developing lipofuscin, right? Why? Because we end up losing the ability to properly manage free radicals and such. So neurofibrillary tangle is part of normal aging. However, in Alzheimer's disease, there's an accelerated accumulation of hyperphosphorylated tau protein in neurofibrillary tangles. So much so, what you must understand is that the degree or the concentration or percentage of neurofibrillary tangle as it increases correlates with the severity of the disease. Pretty important stuff, isn't it? Oh, yeah. Now do you understand as to why I've been so dramatic on this particular point? Next. So what is it? It's tau, T-A-U. What happened to that tau? It got hyperphosphorylated. I'll take you back to biochemistry real quick. Give me the name of the enzyme that causes phosphorylation. I'm sorry, what did you say? I think you said kinase. Right on. Exactly right. It's kinase. So you're going to have a type of kinase that is undergoing or accelerating its phosphorylation of your tau. And so therefore, technically speaking, it's axonal microtubule-associated proteins. I would have to say every single word in this particular image or this slide is of utmost importance for you to understand pathologically. Every single word. Let's move on. Microscopically, what else are you going to find? Here's the plate. These are called senile neuritic plaques. You remember that picture that I just showed you of those green rods? Right? Green rods. That green rods represent, this is actually quite interesting. It's amyloid. It's amyloid. What kind? What do you mean what kind? Is it kappa lambda? Is it beta amyloid? Is it, I don't know, Portuguese? So all I'm saying is it's amyloid. As far as you're concerned, amyloid, Congo red stain, and it then appears as being your apple green birefringence. You know that. So green is a wonderful color to show you there. And so therefore, a bunch of these green rods are beta amyloid that are now aggregating, and they then form a plaque or a plate. Focal, spherical collection of your dilated tortuous silver staining neuritic processes. And so therefore we call this dystrophic neuritis. And that's around the plaque, the dystrophic neuritis, so the neurons are dying. And then that then surrounds a central amyloid core surrounded by a clear halo. All of this is then referred to as being the plaque. This is an important description. So you're surrounded by the dead neurons. We call it dystrophic neuritis. And in the middle, you'll have your beta amyloid plaque. Now, the dominant component is going to be your amyloid precursor protein, which then breaks down into, this stands for beta amyloid. Is that clear? Be careful, please. This says beta amyloid. So amyloid beta, in other words. A representing amyloid. The operative term is beta. Where is it coming from? APP. What does that stand for? Amyloid precursor protein. Once again, yet another important microscopic feature of Alzheimer's disease. What else? Well, found in abundance in the hippocampus. What is found in abundance in the hippocampus? Don't just memorize what I'm saying. Ask me. Dr. Raj, what is found in the hippocampus and the olfactory bulb? What did we just talk about? What are the tadpoles called? Neurofibrillary tangles. What is it? Hyperphosphorylated tau protein. And then what was the other one? That was a beta amyloid collection of plaque surrounded by dystrophic neuritis or dead neurons. Good. That was the beta amyloid. That is what is found in the hippocampus olfactory bulb. And what happens? Remember that picture that I showed you of the hippocampus? Now you're telling, in Alzheimer's disease, you're going to tell me, Dr. Raj, I'm sorry, but I didn't find a hippocampus in that Alzheimer's disease brain. Very good. Exactly right. At some point in time, the hippocampus is gone, as are the memories in your patient. Retrograde amnesia. Everything in the past has been completely wiped out. Clear. What about that amyloid? Oh, it's everywhere. It's everywhere. It's wreaking havoc. And where else could it accumulate? Around your blood vessels. What do you think you call this? Pathology of your blood vessel in the brain. Amyloid angiopathy. Clear? Good stuff. Hope you're liking it. Know everything about Alzheimer's disease. And make sure that you do medicine all your life. Because the more that you keep your brain active, research is showing that perhaps you'll be able to prevent Alzheimer's disease. Just saying! Let's move on. So what do we have here? On your left is your neurofibrillary tangle. On your right is the plaque. You knew that already. On your left, which one of these looks more like a tadpole or sperm in the brain? The left. That's your neurofibrillary tangle. What is it? Hyperphosphorylated tau protein. What is it on the right? You see that plaque in the middle? You did a silver stain. What did you find? What kind of amyloid? Beta amyloid. You're doing this in your sleep, aren't you? Just closing your eyes. It's information. It's just coming out of you. You can't help it. And what is surrounded by? Dead neurons. What do we call this? Dystrophic neuritis. Very good, y'all. Let's move on. Alzheimer's. So what's my prevention? Kind of difficult, but maybe acetylcholinesterase inhibitors. What does that mean to you? Remember, please, if deficiency of dopamine is Parkinson, deficiency of acetylcholine is Alzheimer's. How about convenience? ANA. What does that mean? Acetylcholine and Alzheimer's. Close your eyes. Acetylcholinesterase. Where are you? Normally, where are you? Okay, you're at the junction. Good. And normally responsible for breaking down your acetylcholine. And so therefore, in the brain, if you're able to inhibit acetylcholinesterase, the drugs include donepezil. That's a big one. Another one called rivastigmine and tacrin. Know these. And therefore, what are you going to do to levels of acetylcholine? You're going to increase it. And maybe, perhaps, by doing so, prevent your progression. It is proven to slow the progression. However, it's not the cure. Definitely not the cure, unfortunately. Prophylaxis, maybe anti-inflammatory, antioxidants such as vitamin E. But there's really no data, so I'm just going to quickly go through this. Associated symptoms, oh boy. Yeah. Definitely depression, agitation, sleep disorders, late onset hallucinations, delusions. They have all kinds of issues, don't they? They walk out the door, maybe they're naked. They don't know how to come back. You find them wandering. You do find these such cases, don't you? And you introduce yourself every single day because they forget as to who you are. And depression, obviously. So a lot of associated symptoms. Spend a little bit of time with Alzheimer's disease, please. Summary. Risk factors, female, genetic predisposition. I talked to you about PS1, PS2. Specifically talked to you about ApoE4. That's where focus should be on. You also have Down syndrome and you have trisomy 21. Things we've talked about in great detail. Preventive medicine, antioxidants, but really no data out there. Continued mental activity. Aha, I told you about that, huh? Hence my addiction to medicine. Medicine meaning mental medicine, huh? I don't take anything here. Move on. Signs and symptoms. Short-term memory loss. Getting lost in familiar places. Differentials. We'll get into these. Frontotemporal dementia, formerly known as Pick disease. What else do we have? Wernicke-Korsakoff. What do you know about Wernicke-Korsakoff? Probably a drinker, alcohol. What may then happen over a period of time? You lose your thiamine, maybe damage to hippocampus, so on and so forth. Normal pressure hydrocephalus. We talked about this. And we'll talk about this further. Syphilis. Diagnostic workup. Now, how do you, this is an important paragraph. You want to rule things out, okay? So you're doing a neurologic examination. and you found papilledema, and what are you thinking of possibly? Maybe normal pressure hydrocephalus. Argyll-Robertson pupil, that to you should indicate neurosyphilis. Ophthalmoplegia, here maybe Wernicke's or progressive supranuclear palsy. And always check for TSH and B12. Diagnostic workup, all for B12, so you can rule things in, rule things out, so that you're on the right track of management. Extremely important. In terms of management, let's move on to the next column. Here we have cholinesterase inhibitors, and here, where are you? You're trying to save the brain. So this is not so much about myasthenia gravis. Please don't do that right now. I want you to know about donepezil, and we talked about rivastigmine, Tacrin. And side effects are mainly bradycardia and vivid dreams due to such drugs. Keep these in mind.